Talofalava, Malawalele, Kiorana, Whakalofalahi atu, Nisa Bulavanaka, Maloni, and warm Pacific greetings. Welcome again to Tamaki Makaurau for today's regional update on the Omicron response here in Metro Auckland, today with a Pacifica focus. I'm Andrew Old, the Chief Clinical Officer for the Northern Region Health Coordination Centre, and I'm thrilled to be joined today by two leading community response partners from the Pacifica community here in Auckland. Today we will provide all the regular national and Auckland regional numbers from this Omicron outbreak, but then we will shift our focus to the Pacifica response here in Auckland. We will then hear from members of the Pacific Collective who've been working with us in Metro Auckland in the Pacific response. I'd like to welcome the Chief Executive of the Whono, Tavita Funaki, and Dr. Fiona Mariner-Shepherd from South Point Doctors, who shortly will each outline the many months of incredible mahi their teams have been doing to keep their communities and all of us safe. But first, today's numbers. Today, there are 15,871 new community COVID cases across Aotearoa, 2,982 of those here in Auckland. There are 899 people in hospital, 510 of those in Auckland, 27 in ICU, 11 of those here in Tamaki. Today we are also reporting a further 13 deaths from Covid-19 in Auckland, Waikato, Bay of Plenty, Hawke's Bay, Taranaki, Mid-Central, Wairarapa and Wellington. We send our deepest condolences to all of their families and to all of those who've lost loved ones throughout this outbreak. These deaths are also a reminder that while we may be starting to see some reductions in overall COVID case numbers, we cannot afford to take this virus for granted. We need to continue to be vigilant, especially when thinking of the more vulnerable people in our communities. Further details of today's numbers will be provided as usual in the Ministry of Health's written 1 p.m. update. So case numbers in Auckland have declined consistently now for about 2 weeks and are a third of what they were at the peak of our outbreak. Although we are continuing to see high hospitalisation rates here in Tamaki Makaurau, they have thankfully started to follow the trend in case numbers and have also started to decline over the past week. Although new admissions are falling, we're still admitting an average of over 100 people per day to our regional hospitals with Covid-19, and tens of thousands more people will still get Covid-19 in the coming weeks. It's important for all of us to remember that past the peak does not equal out of the woods. With changes to the traffic light framework allowing us to head back to things like sports and social events this weekend, we need to remember that there are still many people in our community being adversely and disproportionately impacted by this virus. As an example, almost 300,000 people in the northern region are aged over 65. It's about 1 in 7 of us. And although cases in our older age groups have remained relatively low so far, with greater mixing comes greater risk. We're all interconnected, and so whilst out there making decisions for ourselves, please continue to be mindful of older people and young ones, as well as those with underlying health conditions that put them at greater risk. They all need our help to stay safe. We also need to be mindful that while we are seeing improvements in numbers here in Auckland, this is not the case for communities in many other parts of the country yet. My message today is to continue to exercise caution, especially if you do have friends and whānau who are more vulnerable. Enjoy the weekend activities you have planned, but please keep up the mask wearing and other good public health measures. Stay home if you feel unwell, take a test if you have symptoms, and keep reporting both your positive and negative results, as this helps us continue to track the virus and ensure we're putting the best measures in place to keep everyone protected. I also want to reiterate comments I made last week about being prepared for winter. For 2 years, we have not had to worry much about other viruses circulating through our communities, but with borders reopening and winter approaching, we need to give this real attention. Covid-19 will be with us for some time yet, and the combination of Covid, along with flu and other diseases such as RSV and the potential for typhoid or measles, could create significant pressure for our health system in months to come. I strongly encourage you to get your flu vaccine if you're eligible and make sure that your childhood immunisations, especially the likes of MMR, are up to date. Your GP will be able to advise which vaccinations your tamariki need to have and at which stage. And remember, if you're still due a booster and your child is due a first or second COVID vaccination, these can be administered at the same time. The good news is that masks are effective protection against a range of respiratory diseases, so they will remain a valuable tool to keep us all safe in the months ahead. As I said earlier, we wanted to use today to reflect on the significant work of our Pacific community partners. To help put it in context, I'll take a moment now to look at the impact of COVID-19 on our Pacific population here in Auckland. Pacific peoples have made up about 28% of all Omicron cases in Auckland to date, but that's peaked at over 50% of cases earlier in the outbreak. 43% of all hospitalisations in this outbreak have been for Pacifica peoples, and similarly that peaked at over 60% early in the outbreak. Thankfully, the number of new Pacific cases has halved in each of the past 2 weeks, and was 5,209 new cases to Sunday the 20th of March, compared with 10,690 in the week prior. And this week, so far, we're looking on track to halve again. New Pacific hospitalisations have also dropped about 17% week on week, from 469 in the week ended 13 March to 387 last week. Since early 2020, Pacific providers have been partnering with the NRHCC as part of our Pacific response to COVID-19. This has included mobile units for testing and vaccinations, community-based assessment and testing centres, support for localised outbreaks, community management with churches, a regional outreach-based vaccination program, and the provision of health and welfare support for families isolating at home through whānau HQ and support for the Regional Pacific Coordination Hub. As just one example of the contribution, between them, the Whānau and South Seas, two of our providers, have administered over 100,000 COVID-19 tests to their communities. The success of our programs has come down to the support and hard work of all of these community partners, so I'm delighted to hand over first to Tavita Funaki from the Whānau to provide some first-hand further background on their work that they've been doing. Tavita.
Thank you, Andrew. Malolele. As Andrew said, the Whānau is part of a collective of Pacific providers who came together at the very beginning of this pandemic to ensure that our communities got the best level of care they could at a time of great uncertainties and naturally a great deal of concern. It became evident very early in the pandemic that Pacifica peoples were most likely to be severely impacted by COVID-19 due to the nature of the rapid transmission rates in large households and gatherings. Our churches, communities, and school events have all been affected over the last 2 years. Often multi-generational households have been impacted and families have lost loved ones. And it continues to hit us hard. Pacific people still have some of the highest hospitalization rates in the Omicron outbreak due to the volume of cases. Since August last year, more than 70,000 Pacific people have contracted COVID-19, and we, together with other collective partners, have worked on a regional basis to ensure families are supported. But the work began well before then. Our team have set up testing sites that have been running since 2020. We established our first Pacific-led vaccination centre in Westgate, West Auckland in May 2021 and have vaccinated more than 92,000 people through that site. And our communities rallied to get people protected with multiple and ethnic-specific pop-up vaccination events where over 31,000 received their COVID-19 vaccine. We continue to support our communities and churches with pop-up events, including this one here at Malaiola Church in Mangere. And this event starts at 3 p.m. today and runs until 7 p.m. It will also operate tomorrow from 9 a.m. to 4 p.m. As our people continue to get Omicron, we are also supporting the NRHCC with its home isolation program. And each day we are calling up thousands of people to ensure that they are safe isolating at home and have everything they need to isolate safely. We have partners out delivering food and medicine and call centre staff doing daily check-ins based on our highest priority families. I'm incredibly proud of how our collective team have worked to support the communities over this time, and I want to take this opportunity to thank every one of them. We also thank all our community leaders for your support and insight throughout this time. As I mentioned, what have been key to this response, though, has been the collaborative approach we have all taken as a collective to ensure that we are prioritizing right areas with the greatest need and getting support to where is most urgent. Last year, together with collective partners including South Seas, South Point Family Doctors, Pacifica Auckland, Pacifica Family Health Group, and Langimale Tongan Health Society, we worked with the NRHCC to develop a new Pacific model of care. This was prototyped in Auckland to respond to the Delta variant and was subsequently deployed for the Omicron outbreak. This model is what we are now using through the NRHCC's regional home isolation hub, the whānau HQ, to ensure our Pacific families get the right support when they test positive for COVID and are isolating at home. The model has enabled us as providers to be able to act much quicker in support of our communities, including having early access to known exposure events, and knowing who the families are we need to reach out to support. To give you further details on our Pacific Home Isolation Program, I will hand over to Dr. Fiona Marina Shepherd from South Point Doctors, who has played an integral part in the clinical support of this program. Aloha bito.
Talofa lava, maloe lele. I echo everything that Tavita has shared with us about the phenomenal collective effort for our people. I feel very humbled to have been part of a team who have supported our Pacifica communities in a time of such huge anxiety and heartbreaking time for many. We have been supporting the Pacific team at whānau HQ since the end of last year. Since that time, we have supported tens of thousands of people during their home isolation period. Since that time, we have also managed to, on a priority basis, manage the different families. Each day, the team at the Coordination Hub will clinically assess which level of support families need. And from there, they reach out to the various collective partners, including ourselves, to do a number of similar triaging phone calls. Collectively, we are making several thousand calls a day to understand the needs of those isolating at home, to ensure they get the right support that they need. In some cases, these families may require a daily call from a doctor or GP to make sure that their symptoms are not worsening. Or in some cases, it may be that they need food or welfare support, and that is where the collective members swing into action, providing food and welfare supplies where the need exists. It is a well-oiled, collaborative, coordinated approach, based on supporting those seen at highest risk first. To put this in perspective, in the peak of the outbreak, there were 5,000 Pacific cases daily. In the surge, the collective partners managed the highest 1,500 families. The Pacific Coordination Hub managed the next 3,000 to 4,000 at-risk families and aimed for first contact within 24 hours of the hub being notified of cases. It has been incredibly rewarding being able to support this work and to be a part of keeping our people safe. We know the pandemic has hit many of our Pacifica peoples particularly hard, and we've all known friends and family who have really suffered both loss and significant hardship over the past 2 years. As a GP, I see firsthand every day just how hard it is for our communities. And we know that while the numbers are coming down, it is certainly not the end of the pandemic for us. Like Andrew, I want to take the opportunity to remind our people to be vigilant, continue to wear your masks, and think about how you can best protect those most vulnerable in your households and villages. I know that you will all be excited about the opportunity to be able to attend the big sports events this weekend, but please do so safely, with the thought of those who you'll be mixing with when you return to your families later. For now, I will hand back to Andrew to conclude.
Thank you, Fiona, and thank you, Tavita. We are so incredibly grateful for everything you have done to support the Auckland community over the past 2 years, and I think actually it would be hard to overstate the contribution of the collective. From the outset, the way Pacific providers have worked together to do what was needed with skill, persistence, humility and positivity has been inspiring. You've all been such a critical part of the regional program, and so on behalf of everybody, I just want to really offer my thanks again. So we are now happy to take some questions, and I would just add we also are very fortunate today to have our Director of the Pacific Health Response in NRHCC, Meg Patasi, on hand as well to answer any questions. So yes, Lucy.
Just wondering if you have concerns with the loosening of rules from tonight, that could mean an increase in cases and hospitalisations.
Yeah, thanks. So the question was, with the relaxing of rules from tonight, are we worried about an increase in cases? I think the relaxing of rules was always a question of when it was going to happen, not if. So we have been planning for that. We are very fortunate here in Auckland that cases are coming down quite steeply. And particularly in some of our most affected communities, such as our Pacific communities, where those cases have been halving. I think with the increased mixing, as I said, there is increased risk, so the messages really are the same around making sure that you continue to protect yourself by taking those sort of public health measures of masking, social distancing, etc. And also vaccination remains our biggest tool in terms of preventing serious ill health. So again, it's really encourage people who have not yet had their boosters to go and get that done. So we are expecting that cases will continue to plateau even with the restrictions easing. There could be a small increase, but that's not what we're expecting.
Considering Auckland's moved through its deep end, should we be looking at moving to the orange regulatory framework?
So I think that's really a question for government, and the situation with the changes to the red setting, I think, and the other changes that are already coming in next week already represent a significant relaxation. So I think from our point of view, we're just continuing to do the work here to make sure that we can keep people as safe as we can and continue to encourage people to get vaccinated and continue with some of those other public health measures, even in some situations where they may no longer be compulsory.
How many cases of COVID-19 do you think are going unreported in the community because people have to work and not get tested?
Yeah, thanks. So the question was how many cases might be going unreported. Look, that's a really difficult one to predict. It's probably, but the best estimation we've got is somewhere up to half of all of the cases might be going unreported, so the actual numbers could be double what we're seeing in terms of the number of infections. I would say, though, that all of the modelling that we've done and that has been done nationally on our behalf has allowed for the fact that we won't detect all the cases, so it's allowed for the fact that without literally going and testing every person, we're always likely to miss some. But as I say, I think the best estimates that we've got at the moment is that it's probably about missing about half of cases.
Yeah, and have sick leave provisions been enough to support Pacifica communities?
I probably can't comment on that particularly. I'm not sure whether any of my colleagues want to talk to that, but I know sort of through government there have been various welfare packages, and certainly a lot of our Pacific response has been focused on supporting people to safely isolate at home, and that has included both health and welfare support.
We've just been at Polyfest, as you know, there are students performing here, and they say that 50% of their students have been isolated and doing it really tough. Their families have been impacted, and they are struggling. I've been told by multiple students their families are struggling. Do you believe the support, particularly for Pacifica student families, has been enough?
Well, I think for the community here in Auckland, I would say the response that our Pacific community providers have been able to wrap around has been incredible. I would also say that the sheer volume of cases in Auckland has also been really challenging. So, as Fiona mentioned, we peaked a few weeks ago with 5,000 cases per day. Thankfully, that's down to about 5,000 cases in a week last week. So there certainly was a point there. I think a couple of weeks ago we talked about it being something of a perfect storm, with both people in the community being off work, but also the people caring for them in our health and systems also being off as well. Thankfully, those things are improving now, so I would expect that all of those would continue to improve.
What are the current stresses on our system at the moment, perhaps for Pacific families in particular?
I think some of the key concerns within our families is definitely around access to basic supplies, which we've been working through in terms of getting those support to the families. The second thing is there's definitely some level of, there's a huge number, so the level of anxieties and things that are within the families have also impacted. Some of our families are also affected through the employment stuff. So just a bit of security going forward. So it drives some of these stresses in there.
Yeah, well, that anxiety is a good point to raise, because obviously we've heard Pacific families often follow medical advice to the letter and often sometimes over self-isolate, isolate themselves from their whānau to an extent that's not really advised. Are we still seeing that?
I think we didn't see quite a significant rise in terms of the anxiety stuff, but what we've seen through in terms of the families that we're looking after, that are high risks, that the large majority of the families in the household actually end up getting COVID-19 in there. So the hurdles and actually the support has to be much more holistic, not just the food, not just the clinical stuff, but also the whole. It's a whānau water-based approach.
And what are we seeing in terms of the time it takes for whānau to receive clinical and welfare support? How long has that taken for you guys?
Our aim is to connect with them within the first 24 hours. So whether it's the team at the NRHCC from our Pacific Hub in there, or our team of clinicians and nurses that actually connect with them. And then we'll pass that on into the Manaki support through our welfare support. So the aim is actually to get to the families for 24 hours. What we've seen is there's also not targeting just those people that are actually in larger household. We've also been particularly mindful of those specific people that were living on their own to ensure that those support get to them as fast as we can.
And how well are you executing that aim? Within 24 hours?
There's no doubt that it is. I think the key learnings that we have during this whole COVID, and in particular around Omicron, is that the collaborative efforts, it takes the whole village to support. So all the providers still work hard.
Is the whole village supporting your services enough? Do you need more government funding, particularly for Pacifica providers?
I think there's, we'll welcome some of the resources to come through. I think it's more that we're working through around the infrastructure support of the providers to be response. I think what we've worked closely, that's why we needed to actually collaborate together because our workforce around Pacific is actually very limited. So what do we need to actually prioritise through that?
And so how much money do you need and what do you want to be prioritised?
It's probably be another budget bit on its own, but I think when we look, there'll need to be some significant investment into it.
When you say significant, just give us a ballpark figure, please.
I can't tell you that on the top of my head right now.
We're coming out the end of the peak, so would you like to see more support earlier on?
I think what we've also learned through the COVID response stuff, it's about the level of preparedness and readiness of our families. I think we'll see if there's a long tail in terms of the impact on our Pacific families. So, we're working for them to ensure that, we stockpile some of those essentials should there be future outbreak in there. But also some of the basic stuff, the contact number for your GPs, the number of, your close contact stuff. So just, I think what we'll be working closely with taking forward is a key learning for us is ensure that those preparedness of our families for the next outbreak.
Sorry, you gave some really good numbers
I, I think when we look in terms of, as Andrew quoted on, there's about 46% of the cases that were actually Pacific.
How much of the population?
15% of the population.
So sorry.
Yeah.
And just to add on that, so the number of deaths as well, how many of those who have sadly died because of COVID-19 are from Pacific communities?
I'll probably pass that on to me. Thank you.
So between August last year and March now, we've had 32 Pacific deaths in the community.
A question for Andrew. You said that the hospitalisations are starting to decrease. So when can we see hospitalisations fall to a position where the health system no longer faces an unsustainable number?
So the question is, when will we see hospitalisations fall to a sustainable number? I would say one of the things that we've seen with this outbreak is that we're building on an already stressed system. I think we've talked about that a little bit, that even before this we were running with significant staff vacancies. And so the system is going to continue to be challenged, I think, for quite some time. Thankfully, COVID as an individual contributor to that in Auckland is starting to come off, and we have daily meetings with all of the hospitals, and the pressures do seem to be coming off, but they're still really significant. And as I mentioned earlier in the briefing, winter is coming, and we expect that will be significantly stretched again.
And also, so most fire and emergency New Zealand staff are considered health workers because of their proximity to paramedics. However, police who are also regularly in close proximity to paramedics do not fall under the health mandate after April 4th. Why is this in our policy settings and the definition of mandated health workers being reviewed?
I can't comment on the mandates question. You'd need to address that to the ministry or government. Sorry.
How our hospitals coping at the moment? Have we had to open more COVID wards? What's our staffing level like?
Yeah, thanks. So the question was, how are we coping at the moment? So I would say, better, but still really stretched. So as an example, Auckland Hospital today is still operating, just at sort of minimum service delivery. So, and across the city, we're still deferring most non-urgent outpatient and surgical activity. That is starting to improve. We haven't opened any additional COVID beds, and we would expect that position would start to improve over the next week to 2 weeks. But I would say, we'll never get back the capacity that we've lost over the last few weeks in terms of some of those deferrals. So it is going to take a significant amount of time to catch up.
Have you got projections on that?
I don't at the moment, no.
Just one other one. Given our state of the outbreak in Auckland, like I say, we're going down quite steadily. Is there a message to Aucklanders who are still feeling anxious and fearful going out to bars or hospitality or just general business anywhere to say there is less risk now than there has been? Maybe there's a message. Is there a message to say that anxiety shouldn't be as high as it is?
I suppose I would say I'm cautious to give that message yet. So earlier I mentioned that past the peak doesn't mean out of the woods, and we are still getting many thousands of new cases a day, and we would expect to continue to get many thousands of new cases a day for some time. So whilst we're not on that sort of steep upward trajectory that we were, and so the risk is less, that is balanced by some of the restrictions coming off. So I think really people do need to make their own personal risk assessments. Everybody's situation is slightly different. And I guess what I would just ask everybody to remember is when you're making your own risk assessments, think of that in the context of the interconnections that we all have and how that might impact on vulnerable friends, family and others in the community.
I've just got a question for Fiona, if possible, just finally. So as for Pacifica providers for Pacifica by Pacifica, how are the staffing levels in that area coping compared with the collaborative approach with other providers?
That's been essential. Having that collaborative approach has meant that, because we're all human too, we all, potentially could have COVID as well and have illnesses within ourselves and our own families. But with having the collaborative approach, if one team's a little bit down, the other team can step in and help. And so, yes, it's essential.
What team has been down more? I mean, have you had enough staff throughout this whole thing on both sides of the
I think we've had sufficient. We've sort of monitored that as we've gone along. If there has been a need, we have sometimes taken our healthcare assistants, for example, and trained them up specifically to help us with our team. So even though we've acted separately in our own individual clinics and things like that, we've still been in communication daily, supporting and helping one another through this endeavour.
And finally for me, Polyfest has decided not to open the floodgate gates this Saturday, despite being able to under the new rules. What do you make of that decision?
Well, everybody's got to make the right choice for their own circumstance and situation. But given that we are not fully out of the woods yet, as Andrew has said, we're still coming down, yes, but we're not out of the woods yet. So I'll leave that to them to make the right decision for their people. Each person is entitled to do that. But there is probably clear reasoning and explanation as to why they've made that choice and decision.